Diffusion in the respiratory and cardiovascular system. The function of this process is to regulate the transfer of oxygen and carbon dioxide in and out of the body. Oxygen is fuel for the cell and is inhaled to be used during cellular respiration. Carbon dioxide is a waste product of cells and is exhaled through cellular respiration. Both gases travel through the lungs, going either into or out of the alveoli, which we will talk about later. Air is inhaled or exhaled through the lungs through a process called perfusion, aka the movement of the diaphragm. The diaphragm is a muscle located directly below the lungs. When the diaphragm contracts, it moves lower down in the body. As the chest enlarges, the pressure inside the lungs decreases, causing air to rush into the lungs during inhalation. When the diaphragm relaxes, it shrinks the chest cavity and air is pushed out. The lungs are composed of alveoli, which are made up of individual alveolus. This picture is from Socratic.org to provide a clear picture. An alveoli is a bunch of tiny air sacs grouped together. The shape of the alveolus allows them to group together easily, increasing the surface area of a single alveoli and increasing the rate of diffusion. Capillaries cover each alveolus and are only 1 cell thick, which is important for the diffusion of gases, which we will go into detail about later. The heart. This picture is from yourschoolaid.org. Oxygen-rich blood will be shown in red, and oxygen-deficient blood will be in blue. Pulmonary veins carry oxygen-rich blood from both the left and right lungs to the left ventricle of the heart. It is then pumped out and away from the heart through the main artery of the body, the aorta, and into the body's system of arteries. Meanwhile, the vena cava, the main vein of the body, brings blood filled with CO2 from cells in the body back to the right ventricle of the heart. It is then pumped out and away from the heart through a system of pulmonary veins to go back to the lungs. Now back to the alveoli to explain what actually happens between those capillaries and alveoli. On the bottom left, we have a single alveolus with a cell membrane in gray. It is surrounded by a capillary and both are only 1 cell thick. Blood traveling in the pulmonary arteries from the heart into the lungs has a high carbon dioxide concentration and is both dissolved in the blood and attached to the red blood cells, pictured in pink. As the oxygen-deficient blood moves through the capillary, carbon dioxide diffuses out of the bloodstream, where it is in high concentration, through the membranes of the capillary and alveolus, and into the alveolus, where CO2 concentration is low. Oxygen in the alveolus diffuses from the alveolus, where it is in high concentration, through the membrane of the alveolus and capillary, and into the bloodstream, where CO2 concentration is low. Both gases move down their concentration gradients. But how does oxygen remain in the blood so easily as it travels through the body? Well, it remains there in one of 2 ways. One way is oxygen dissolving directly into the blood. The other has to do with the structure of the red blood cells. Red blood cells contain these proteins called hemoglobin. Hemoglobin is in its quaternary structure and has iron in each of its polypeptide chains, pictured in green. The oxygen binds to the iron in the hemoglobin and is then transported towards the heart. Overview! Air containing both oxygen and carbon dioxide is inhaled when the diaphragm contracts. The oxygen moves into the alveoli of the cells and diffuses through the alveolus wall into the bloodstream via capillary. Once in the blood, the O2 dissolves in the blood and binds to the iron in the hemoglobin of red blood cells. This blood then travels through a system of pulmonary veins into the left ventricle of the heart and out through the aorta towards the rest of the body. The O2 then diffuses into the cells that need oxygen through simple diffusion along its concentration gradient. Cells' CO2 waste diffuses through the cell membrane and into the blood along its concentration gradient. This CO2-rich blood then travels through a system of veins into the vena cava, where it passes through the right ventricle of the heart and out through the pulmonary arteries. The CO2 then diffuses into the alveoli along its concentration gradient from high to low as well, and the diaphragm relaxes, moving upwards and exhaling the CO2-filled air out. The cardiovascular system of veins and arteries from the heart carries important nutrients to every cell in the body, as well as carries waste and toxins away from cells. This whole system starts and ends with the lungs, and this is why the lungs are so important in the transfer and diffusion of gases. The lungs provide that specific place for oxygen and carbon dioxide to be transferred in and out of the body easily. Emphysema is a disease of the respiratory system that occurs when the alveoli in the lungs become overinflated and the lung tissue responsible for the transfer of gases is damaged. As a result, CO2 and O2 cannot pass as easily in and out of the lungs. The primary cause of emphysema is the inhalation of chemicals into the lungs through breathing in polluted air or smoking. People with emphysema will suffer from shortness of breath, coughing, and a lowered tolerance for exercise. But how specifically does emphysema affect the lungs? Inhaling polluted air harms the lungs in two ways. It destroys lung tissue and results in the inflammation and irritation in airways, both of which obstruct airflow. Chemicals in the polluted air can cause the cilia in the lining of the air passages to disappear, preventing the clearing of mucus and other secretions from the lungs. Mucus builds up and provides bacteria an optimal site for infection. Immune cells in the lungs are also affected by cigarette smoke and polluted air because they cannot work as effectively. As a result, people with emphysema suffer from frequent lung infections due to destructive enzymes released by the immune cells. Over time, the enzymes that are released from the immune cells reduce the elasticity of the lungs. In addition to the destruction of the alveoli in the lungs, airflow is reduced. For smokers, the most effective way to stop further deterioration of the lungs is to stop smoking and discontinue your lungs' exposure to harmful chemicals. Doctors may also prescribe medication that helps with addiction to nicotine. More general treatment is also available. Bronchodilating medications are often prescribed to emphysema patients. Bronchodilating medications opens up airways and allows for the more efficient transfer of gases such as CO2 and O2. Steroid medication is a way to decrease the inflammation in the body and stop the production of harmful enzymes by the immune cells. People can also inhale oxygen using tanks or by inserting a tube into the windpipe to allow a machine to assist breathing. In regards to surgery, lung volume reduction surgery is one option. LVRS reduces the size of the lungs in order to allow the lower portions of both lungs to expand more effectively and increase efficiency of breathing. Lung transplants are also an option, however there is a risk of rejection by the body. All in all, your cardiovascular and respiratory systems are quite important, so take care of yourself and stay healthy.